Hello, everyone, and welcome to Chapter 3, Pharmacology and Medications in your Pathology for the Massage Therapist course. So, America is special. We take drugs all the time. You need to be aware as a massage therapist that a grand majority of your clientele will be on prescription, over-the-counter, or illicit drug substances, or something else that is a mood-altering or physical-altering substance. So nearly 70% of the U.S. population takes at least one prescription drug that is actually tracked. We know that many more people than that take drugs that are not tracked. This also does not track over-the-counter medications. These are prescribed by a doctor to a patient. So 7 out of 10 people on average that come into your office will be on some type of prescription medication. And of course, the most frequent ones listed here are high blood pressure, high cholesterol, diabetes, acid reflux, pain. Pain is a huge one that you need to be aware of for massage therapy, which is why we're doing a lecture. Chapter 3 is a small chapter. It's not as quote-unquote important to you as some of these other ones as a massage therapist, but you do need to be aware of the effects of these medications, especially those taking pain medications. And obviously, depression medications are also up there as one of the main prescribed drugs in the United States. Now, drug use may affect treatment planning. Depending on the drug that your client is taking, it's going to affect how you give them massage, where you give them massage, how often you give them massage, and more importantly, the pressure of the massage that you are going to do in the treatment.
So here's 3 things you may not know about prescription drug addiction. Number 1, most people get their drugs from doctors, friends, or family. Number 2, over 50 million Americans over the age of 12 have misused prescription drugs sometime in their life. And number 3, painkillers are the number 1 most abused prescription drug. Be sure to follow us for more recovery and addiction information.
We are not pharmacists, we are not doctors, we are not nurses, but we still need to know some things about drugs and drug effects. What is a drug? It is a substance used in the diagnosis, cure, mitigation, treatment, or prevention of disease. Pharmacology is the study of drug uses, mechanisms of action, effects, movement, and dosages of drugs. And pharmacotherapy is the treatment or management of diseases and disorders through drug administration. Not only should you care about drugs because it affects your treatment plan, but also because your clients care about their drugs. People pay attention to what costs them money very frequently. And this is an interesting little chart. It is a per capita prescribed medicine spending in US dollars. Now, these are basically copay dollars. This does not incorporate Medicaid or Medicare. It is cash spent on drugs. This blue line, you can see the country average around the entire world. And there's the United States in the green line. We are winning so bigly with over twice the amount of money spent as the average country in the world on prescription medications. I won't go into the details about why that occurs or how that occurs, but just know that your clients care deeply about the diseases that they are trying to control with drugs and the drugs themselves. And very often, those who cannot have access to their prescription drugs may get them in an illicit manner and may not tell you. So you need to know the signs and symptoms of drug use and drug abuse. For example, look at the cost of insulin pens in the USA compared to Norway, Thailand, Australia, Mexico, Taiwan. I mean, the first 5 countries listed don't even break $50. And the next 3, Italy, Canada, Germany, don't even break $100. It is $700 per vial on average for the cost of insulin pens. This is a recent average cost. It's the same medication. It's an epidemic in America, the cost of medication, but also everyone is on medication, so it does affect your massage therapy practice deeply. So what are the effects of these drugs that everybody is taking? There are two main categories. There's the therapeutic effect, which is the primary desirable and beneficial effect, which is usually things like decreasing pain, decreasing blood pressure, helping someone not get pregnant, these type of things. A side effect is a secondary effect that's usually undesirable, but fairly predictable. Like a wide range of people will have mild side effects, and a small percentage will have, the major side effects, like such as rash or an allergic reaction. A mild effect would be drowsiness, like with antihistamines listed here on the slide. A major one would be something like Cipro, which is an antibiotic, can cause your joints to completely rupture and paralyze you for life from an antibiotic. Good times. Now, an adverse event is the harmful effect of drugs like allergic reactions and overdoses. I think that we can put some of those major side effects, such as Cipro's exploding joints, in that category as well. Drug abuse is an adverse event. It's a misuse of therapeutic or recreational drugs, and this can lead to addiction, dependence, serious physiologic injury, such as ruptured joints, psychological harm, or even death. Another side effect of drugs that I want to discuss is vaccine shedding. So a lot of people were talking about vaccine shedding during COVID-19, which is actually not possible. Vaccine shedding is when an individual releases or sheds the components of a vaccine either inside or outside of the body, but that can only happen with a live vaccine, which COVID-19 was not. Some examples that are commonly given in the United States are like for the measles, the mumps, and rubella, which is the MMR vaccine, the flu nasal spray vaccine, which is the flu mist, rotavirus vaccine, and the chickenpox vaccine. Now, due to the live virus being so significantly weakened, the pathogens in these vaccines don't actually cause disease. The only exception to this is in immunocompromised individuals, which wouldn't be recommended to get a live vaccine anyway. Because these live vaccines can replicate, the weakened pathogen can be shed off of the person that's had the vaccine, but that's not the same thing as disease transmission. The weakened pathogen being passed on to another person is highly, highly unlikely to cause disease. The only live vaccine ever tied to infections due to shedding is the oral polio vaccine, which is no longer even in use in the United States. So if you hear things about vaccine shedding and not being able to work on your patients for 6 weeks or something like that, please look into a trusted medical source. Try the CDC, try the World Health Organization, but make sure that you get your facts before you turn away a client or before you do work on a client to keep yourself safe, keep your client safe, and to keep the public at large safe. Although you won't be using these abbreviations very often, if you see it written down in your client's health take form, these are some of the most commonly used abbreviations. You will see PRN as a contract worker as a massage therapist for quite a lot of positions. It just means as needed. So you'll be called in to work when there is a massage appointment booked and not necessarily required to stay there all day if you do have a contract job. So you'll see that for something other than medication terminology. But just take a look at these and be aware of what they stand for. Oh, massage and alcohol consumption. So alcohol is a depressant, and it sort of acts on the body in a similar way to skeletal muscle relaxants. So you want to apply the same massage considerations. It says that alcohol can cause impairment, not incompetence, that there's no current evidence the massage increases or decreases alcohol absorption or metabolism. And there's no current evidence receiving massage after consuming alcohol results in massage-related injuries. Not in injuries, but some anecdotal evidence. So take it with a grain of salt. But I know that myself and at least 2 other long-term therapists have massaged people, especially women, after consuming alcohol who became significantly more impaired as their circulation increased. And what we assume is that the alcohol, went throughout as well with this increased circulation and caused the clients to become quite a bit more intoxicated. I do think that there is a lot of evidence to show that impaired judgment can also be stated as incompetence. I would never recommend working on a drunk client. Not only is their behavior unpredictable, it can lead to a myriad of disasters, especially legal ones for you if anything occurs that is untoward. And then they state, well, I was under the influence, so I didn't know what I was asking for. So please protect yourself. Do not massage your clients if they have been drinking. Now, this brings up an interesting side note. Some spas and many small private offices actually offer free alcohol to clients. Now, you can't sell it unless you're like a large hotel chain, something like that, and you have the proper licensing. But should you offer the alcohol to them? If you go to your actual PowerPoint, this slide is in there. You can click on this link to read an article about it. I suggest you do some research if this is something that you want to do. I have worked in at least 2 locations that did offer free wine to the ladies and beer to the men. Yes, it was very sexist. For alcohol consumption prior to and after their massage. I don't necessarily think that I would ever do that in my own private office. I do offer things like decaffeinated tea, sometimes some interesting juices, obviously water, vegetable or fruit water as well, but not alcohol for multiple reasons. You absolutely don't want an alcohol and medication reaction to occur in your office either. That could lead to another lawsuit, whether or not you gave it to them for free or you sold it to them. Okay, well, how does medication get into your body? You can take it orally. It enters the digestive tract. This is the most common route, meaning you pop it in your mouth. You can inhale it. It enters the respiratory tract that way, like asthma and emphysema medications. Or like my mother's late husband, Larry, you could become addicted to nasal sprays. Yay for Vicks. And there's also injection routes. Injection is delivery through a hollow needle and enters the cardiovascular system. You can do it subcutaneously, intramuscular, intravenous, and intradermal. Now, the most common ones that you're going to see patients doing to themselves are subcutaneous and intramuscular. Anything that is done through IV or intravenous going into the bloodstream itself is usually going to be done by a professional such as a nurse, whether that be in home health care or in a hospital setting. So the ones that you need to worry about the most are ones that have been done recently and ones that are done subcutaneously or intramuscular. Now, another way that you can receive your medication is the topical route, which is transdermal. A transdermal patch is usually a topical application of a drug product. It goes through the skin or a mucous membrane and enters the cardiovascular system. Now, I'm thinking of something like a morphine patch for people with extreme back pain What about a nicotine patch for people that are trying to quit cigarettes? But there's also ointments, creams, gels, foams, dissolvable tablets are just ones that you put underneath your tongue, known as sublingual. Suppositories, they've stuck it up their bum, and liquids. So a buccal pouch is when they are pressing a medication or a pouch of some sort or a pellet up against the internal cheek wall. Think about people chewing dip. Okay, so this next slide, the first photo you see is very common areas for patches, transdermal patches to be placed on the skin. Of course, make sure you ask your client if they have a patch while you're doing the intake. Absolutely. The second photo, the upper chest area, is usually a place for heart medication. The arms are very common for nicotine patches. The thighs for estrogen patches. Although estrogen is usually done as an oral medication, sometimes as a shot even. Now the back that they are showing for allergy testing is not usually a patch. It is usually a scratch test or a small injection. So it will be a local contraindication or perhaps an absolute one for the first 24 to 48 hours after having those done. But again, it's not usually a patch. This next slide is massage and subcutaneous injections, very specifically insulin. You're to avoid vigorous massage over the sites of recent injection for up to 24 hours. Insulin pumps. This was one of your attendance questions. You just simply don't want to get massage lubricant on the sensor or the transmitter, obviously not the pump or tubing. And you can put a soft cushion down around the pump area just for comfort when the client is laying prone. Sites of frequent insulin injection may have adhesions, which could be reduced by massage, but you need to make sure that they have switched to another injection site, or at the very least, they have not used that particular area in the last 24 hours. And of course, to break up adhesions, one of the best ways to do that is with stretching or cross fiber friction. Somebody comes in with cortisone shots for pain, vaccines, or Botox. Botox is not just done to look like you don't have any wrinkles. Thank you, botulism, for giving something to the world. It is also typically used in a treatment for PTSD, believe it or not, and also for migraine headaches. So you could have a wide variety of clientele coming in with Botox injections that you would not necessarily suspect would be having them. You need to avoid these particular injection sites for up to 72 hours. That could be reduced or extended by the primary healthcare physician, all right? You need to avoid face rests and accessories that put pressure on the injection site for 72 hours. Like if somebody did have Botox in their face, they cannot go face down into the face cradle. Let's not form their face to the shape of a half moon and or a crescent moon, and absolutely, or something potentially worse, causing their face to sag or become settled in that pressurized position, sort of deforming the flow of where the Botox could potentially go and cause a temporary deformity or paralysis in the face. Now, if a client received a smallpox vaccine, you need to avoid the area until the scab falls off. It says it could be up to 3 weeks. You know, if your patient is, or your client is also a diabetic, that could be 4 or 5 weeks. They heal slowly, give them some time. Make sure that scab is absolutely gone. Polio, smallpox, some of the only ones that shedding actually even matters in a vaccine. Another area to avoid a local contraindication is if someone has a subcutaneous pellet. They have a medication pellet placed underneath the skin. The hips and buttocks and lower abdomen are the most common sites of these. And of course, topical agents such as cannabinoids and transdermal patches. Again, we've already covered Transdermal patches, we don't want to do massage directly over them. We don't want to do oil around them either. That can seep underneath them and perhaps lift and render the adhesive that's holding them down on the edges ineffective. And you absolutely don't want to put heat over it. We don't want to cook the medication. We don't want to cause it to be excited with thermal energy and go into the client even faster. Absolutely none of that, please. Hormones, there is like almost no risk of secondary exposure whatsoever. You can simply wash your hands before and after, always. That's standard precautions. Again, standard precautions. Please always wash your hands adequately. Also, go ahead and slap on some hand sanitizer. But you're not going to get any crossover from those. CBDs can be used safely. There's a lot of argument back and forth about their effectiveness, what clients should bring in themselves, if it even matters. I know that many of the major massage lotion companies are pushing the CBD oils. The one thing that I will say about topical agents is a lot of the quote unquote better massage lotions that are used for quote unquote healing have arnica in them. Now, arnica is great for bruise applications and other things. However, arnica can cause heart palpitations in people. Anyone who is susceptible to any type of stimulant, such as caffeine, amphetamines, things like that, people with high blood pressure, you need to be aware of the potential danger of using arnica in these creams. I know this by anecdotal evidence quite well because I am one of those people that becomes very, very susceptible to arnica. I have dried arnica that is it is a flower that I put in some of my handmade soaps that I make, as well as my compresses and other things for clients. And I also use arnica oil for them. I will not do massages with heavy arnica oil inside of my shea butters or lotions directly on clients anymore because I will experience extreme heart palpitations. So just be very, very aware. Even using essential oils, they can have very adverse effects on people. Always ask about allergies. Always do small patch tests. And please be just very aware of your client's behavior, breathing changes, skin changes. You don't want something to happen in your office. Alrighty, medications to manage pain and inflammation. NSAIDs, non-steroidal anti-inflammatory drugs. They're used to reduce inflammation and mild to moderate pain. Think about things like ibuprofen. You cannot recommend these to people. Ibuprofen is wonderful for me. I love ibuprofen. However, ibuprofen stops the healing process, and I'm not a pharmacist. I can't tell people to take it. I'm not a doctor. Nurses can't even tell people to take it unless they've been directed to do so by the doctor, and the script needs to be written by the doctor. Now, a lot of people can't take NSAIDs. My husband, for example, gets into a literal, nearly psychotic rage. He cannot take ibuprofen. He can take acetaminophen. It has different chemical compounds. So please be aware of this. If someone has taken a new drug, even something as innocuous and over-the-counter and easy to get, such as Tylenol or ibuprofen like Advil, you don't know what those side effects are going to be. So always stay on alert, even for the basic stuff. People with ADHD have adverse effects with a lot of the medications that are supposed to cause drowsiness, especially with like children. They will become hyper and overactive when they take Benadryl rather than getting sleepy, which is the most common side effect. All right. Corticosteroids is something that is very commonly used. It reduces inflammation and pain. Of course, skeletal muscle relaxants. All right. They relax the muscles and reduce pain and spasticity. So it's great that the muscles aren't spasming if they've taken this and then they come in for massage. However, their muscles are extremely relaxed and their pain sensation is dulled. So you're not even aware that the pressure that you're doing might be too deep because they can't feel those pain sensations and they can't tell you when their body has reached its pain threshold or its injury threshold. So please be very aware if someone is taking their muscle relaxants in order to get a deeper massage when they come in. This is a fairly dangerous situation. And of course, the last category here is narcotics and opioids. This reduces moderate to severe pain. It induces sleep. It suppresses coughing. So please be careful in positions that compress the chest, especially in your obese clients. If they're taking a lot of narcotics or opioids, please do not have positional asphyxiation on your table. Make sure that their head is supported correctly, that their pathway for breathing is open, and that they're not having any difficulty or lowered respiration if they're taking narcotics and opioids. And be aware that they do alter mood and behaviors. My mother is one of those that cannot take these type of painkillers. My husband can't take ibuprofen. My mother becomes literally homicidal if she takes narcotics. So this is a painkiller-free house. So just please be aware that these side effects are absolutely something that you need to watch out for. Some of the people coming in for massage have significant back pain or hip pain, and they are coming in for palliative care. Now remember, this is pain relieving care. They're seeking you for pain relief. They're going to be seeking other things for pain relief. Remember those statistics where over 70% of Americans are currently on prescribed drugs. This does not include the things that people are getting off the street, off of family members, off of friends, over the counter, or in various other ways, and they're just simply not reported. All right, so somebody comes in and they admit to you, hey, I popped a bunch of ibuprofen. I took Advil right before I came in. They're fun little candy-coated tablets. Now what do? You need to be aware of possible side effects such as nausea. Overuse of ibuprofen, even though it's not listed here, can wear out your stomach lining and cause stomach bleeding. Definitely quite a bit of stomach inflammation. All right, so you might want to use a semi-reclining position in those that have any type of acid reflux or stomach issues with either nausea or overuse of ibuprofen causing any sort of gastrointestinal problems. You're going to avoid techniques causing the client to rock or shake. Those are usually excellent things to reset the nervous system. You don't want to use those on a nauseous patient, especially not one who's taken some NSAIDs. They might vomit on your table. If they are supine and they vomit, they could also choke on the vomit on your table. And now you have twice the problem that you started with. You should really have a disposable emesis bag available, i.e. a puke bag. Please have a puke bag, a puke bucket, a small trash can with a bag in it that's available for puking. Just have it there. You're going to want it. Also, make sure there's a close bathroom nearby because a lot of these medications have a side effect of constipation, and a decent abdominal massage might get things moving as well for these people. Heartburn, schedule appointment 3 hours after a meal. You want that food to digest and settle. You don't want to be putting pressure on a full stomach. In addition to the heartburn coming up, that acid reflux, you could also cause, again, a little bit of vomiting in the mouth. Bruising, not as much of a problem with NSAIDs as some of these other medications, but with any medication, every body is different. Every medication affects every body differently. So please be aware of potential bruising. Watch your pressure. These patients have a dulled pain sensation, and they're not going to be able to tell you when you are going too deep for them. Massage and skeletal muscle relaxants. I really don't like doing this. I used to not allow my clients to come see me within 4 hours of taking them unless they took them every 4 hours. I would schedule them right before their next dose just so we could get their pain gauged correctly. There is a significant reduced sensation. So inform the client of possible bruising, but please be careful. Of course, there is some dizziness involved with these. So just like with your geriatric clients, you want them to sort of sit up in 3 1-minute stages. That seems dramatic, but the last thing you want is your patient sitting up too fast and then passing out on you and possibly falling on the floor. Drowsiness, sedation, this is a pretty frequent side effect. Quite often, if these clients have taken these relaxants right before they come in, they fully hit, usually within 30 minutes or so, that client will very often fall asleep on your table. So you're going to want to wake them up at the end of the session, verbally, and you're going to want to do some stimulating techniques, either rocking, percussion, those type of things to sort of get them fully alert. You're not going to end with very soft effleurage strokes. That's just going to put them right back to sleep, and you're going to wonder why they haven't left your office and they're still sitting in the chair half dressed. All right. Constipation. Again, we are back to blocked up colon. This is a common thing. Just be prepared for this. Massage and narcotics. Woohoo! More reduced sensation, more possible bruising, more dizziness, more drowsiness, more sedation, more nausea, and more constipation. I mean, these are your typical side effects that you're going to see, especially with a lot of the heavier drugs. So please just be aware of these, but also narcotics and opioids, even though they have the same sort of warning signs as skeletal relaxants, they are, or I should say skeletal muscle relaxants. It doesn't relax your bones. However, these are stronger, that are meant to take care of more significant pain, and they do cause more significant personality and mood changes. And please just be very safe out there because people are crazy. Massage and anticoagulants and antiplatelets. Again, we have nausea, dizziness, heartburn. Again, this is kind of another big one. It falls in line more with the NSAIDs in terms of heartburn. These are kind of the two bigger ones. This is the one that you really need to be concerned about with bruising. This is the big boy with bruising. If they start bruising and they're on very heavy anticoagulants, or if they have a pathology where they have a clotting issue, you could have a bleeder that turns into an ER situation. So please be extremely careful. A lot of the geriatric crowd is on anticoagulants, especially if they have comorbidities or other things going on with them, such as heart conditions. Just please be aware of pressure with this one. Massage with estrogens and progesterone, things like Provera or birth control. You could have breast tenderness. Use a pillow while prone to get some of that pressure off of the breasts. If they have a smaller waist, you can use an abdominal support as well as one up towards the neck. You may want to use a double face cradle depending on the size of your client's breasts. Another thing to watch out for here is nausea, headache, and blood clots, especially for progesterone. It usually avoids the lower extremities, so completely avoid them if they do have a deep vein thrombosis, a DVT. If they don't have a diagnosis, just check for unilateral leg swelling, heat, redness, pain that might indicate that they have some clotting or a DVT in that lower extremity. Massage and testosterone. There's very often a rash that might occur with this hormone, especially at the injection site if it is injected. There will be increased urination, so suggest using the toilet before and obviously after the massage before they leave the office. I would recommend this with all of your clients, but especially those taking testosterone. There is also some breast tenderness with testosterone. So again, you may use a pillow while laying prone, and a headache may incur with this as well. Always have water on hand if your client is able to intake water in case they want to use that. But be careful of, again, the increased urination. You may want to make sure with your clients that are taking this, especially those that are going through hormone therapy or your trans clients, that they are able to get to the bathroom easily during the massage if they need to go in the middle of it because of pressure. Another thing to be aware of very specifically with trans clients is a lot of binding pain and issues caused by some of the medications. Estrogen usage will actually cause a lot of TMJD issues. I'm going to share with you a quick 2-minute clip of a massage creator that is actually making one of the first trans courses on how to provide massage for people that have gone through gender affirming surgery. And this is the 5 top things that they have seen in their clients that generate pain. I want you to see this now in this medication course because some of these things are related to binding or medication that trans clients will take. And this creator, if you want to check out their work, also has some amazing tips on bolstering for various types of bodies for clients for comfort.
Hi, my name is Anna. I'm an advanced clinical massage therapist and I specialize in working with transgender patients. This is my clinic and today we're going to talk about 5 pain patterns associated with gender dysphoria. Let's go. Number 1, shoulder and neck pain. This is your trapezius. It extends the whole of your upper back and is a key muscle which is impacted by fight or flight. People who are within marginalized communities have an increased prevalence of trauma, which means their bodies stay locked into fight or flight. This creates a pain pattern across the upper neck and across the top of the shoulders. For trans people, it is quite literally the experience of transphobia and the fear they feel existing in the world that is giving them this pain pattern. Number 2, joint pain. Stemming up from that upper trapezius area, when it goes unresolved for a very, very long time, we're more likely to develop temporomandibular joint dysfunction, which is when we get that pain in the side of our jaw. This comes about not only from fight or flight, but did you know it is more prevalent in trans feminine patients who are on estrogen? Number 3, intercostals, both inner and outer. The intercostals are impacted by anxiety, which is one of the key defining symptoms of gender dysphoria. This pain is consistent with a bruising feeling around the bottom of the ribs and also up here in the collarbone. If you're feeling this and you have gender dysphoria, the two could be connected. This can also be connected to overbinding and it might be time to take a break. Number 4, early stage lordosis brought about by gender presentation, brought about by, you guessed it, gender dysphoria. In trans feminine patients, there is more likely to be an anterior tilt to the pelvis, which creates pressure on the lower spine, creating this early stage lordosis in the lumbar spine. This creates a pain in the lower back. Finally, number 5, dead arm. This comes about from compression caused by binding and also post-op surgery. The pec minor muscle is compressed up into a cavity called the brachial plexus, which puts pressure on the subclavian artery and vein. This then creates a tingling and a numbness in the arm, which is sometimes described as a dead arm. For reasons like that, why we need awareness of transgender anatomy and pathology in manual therapies. Join me on the course that I co-wrote specializing in the pathology and anatomy of LGBTQ patients for manual therapists. The link is in the bio.
That is it for chapter 3, everyone. I didn't want to leave on a hard note right after this video. Again, if you want to check out bolstering techniques, you're absolutely welcome to check out this creator's work as well as many others. There are some fantastic tips out there. Please continue to do research about medications. You do not need to know every medicine that's available, but I do highly recommend that you get a pharmacological dictionary or a usage guidebook. You can usually find them at thrift stores fairly cheap. These are absolutely amazing. I actually have a couple in my own office. If a patient tells you that they are taking a medication that you are not familiar with, this will help you look up potential side effects that may change your treatment plan. You know, Google is a thing, but it's not necessarily always the best thing, and these are reputable published books that have the most up-to-date information on medications available at the time.